Andrew Munchel had tried to manage his weight for decades, but he never was able to keep the weight off. It was the pandemic that made him realize he needed to get help.
Some of the pandemic really scared me a little bit as a nurse, right? Where if I realized that, the more things played out from, March of 2020, the more we kept seeing that patients who were obese seemed to do worse. And that was the biggest, modifiable risk factor someone really has in this pandemic world. So with that, I kind of sought out the care I'd been, if I'm honest, myself postponing for a long time.
Andrew Munchel is in his late 30s. He's attempted to lose weight through Weight Watchers, giving up meat, fasting, gym memberships. You name it, he's tried it.
So if you've been like someone like me who's tried your whole life and never found success, there's probably a reason, right? There's a lot of stigma I've come to realize around these procedures where it's almost presented as like a personal failing, right? But the more I think about it, it's not. If I could have lost the weight on my own without the help, I would have, right? But if I was unable to do that for 20 years, then it was time. It's time to take control of the things I could and seek out that right medical care.
That medical care came from Dr. Allison Barrett, Director of Bariatric Surgery.
Obesity is a real disease. It is not just a product of how much you eat. There is so much biology and there's so much biology that goes into how we maintain our weight. So by the time people come to me seeking surgery for weight loss, their inherent ability to lose weight is actually very different from what it might have been 10 or 15 years ago, because their body has adapted to being overweight to the point where it gets harder and harder and harder every time that they try, because their body's literally fighting against them.
With Dr. Barrett, it is a bariatric trained surgeon, right? So it's not a surgeon who came to do this procedure through some other means. It's someone who's focused, devoted her training to this, right? So that was a real, selling point for me also.
Andrew chose what's called a sleeve gastrectomy, which involves removing part of the stomach and making the stomach much smaller. A sleeve gastrectomy is a very effective way for patients to lose weight because it limits not only how much they eat, but also really limits their hunger. Patients find that they don't have the desire for food after surgery like they did before. And part of that goes back to their biology. By doing these operations, I'm changing the way their hormones work that affect things like hunger and fullness.
I had the sleeve gastrectomy July the 30th. Now I'm 7 months out and I feel fantastic.
He's dropped nearly a third of his total body weight.
Much of my success was going to be how I treated the recovery phase, so that I needed to exercise right in the before phase, get as much off before as I could to make myself a little bit healthier. And also, right, just the second I get back from the operating room to the room in the hospital, get up and be walking, right? So that'll help me do better, be better. I was up and walking within an hour.
The fact that he has been able to lose 100 pounds from surgery means that he will live a longer and healthier life. Already, he has been able to come off of his medication for blood pressure, as he had high blood pressure before the surgery, and now that has resolved after he's been able to lose weight. Just fixing that issue alone has increased his lifespan exponentially.
To go from about 324 from the first time I met her to around 225 right now, it's just amazing, right? And, I can go shopping in a regular store. It's a whole new world.
Andrew also credits the team that Dr. Barrett put in place with helping him. That team includes a psychologist, a nutritionist, and others. But again, Liz, just 7 months out, and he has already lost 100 pounds. Back to you.
Thanks, Christina. Dr. Barrett is here to follow up on Andrew's case and to tell our viewers how they can get started in the surgical weight loss program.
Joining us now is Dr. Allison Barrett, Director of Bariatric Surgery at Penn State Health St. Joseph Medical Center. Dr. Barrett, thank you so much for joining us.
Thank you for having me.
It's a new year, and many people struggled with weight gain during the pandemic. Some may want to explore ways to shed that weight. Let's talk about surgical weight loss and how it could be the right option.
Surgical weight loss is a good option for people who have struggled with weight for a long time and probably have tried a lot of different diets or exercise programs to lose weight, and they continue to struggle with issues with their weight. By the time patients see me in the office for their first visit, usually they've tried a number of things to lose weight. Surgery can be safe and can be very effective for the right patients. So when I first meet them, we have a long conversation about what has worked and what hasn't worked for them in the past.
And that's what I wanted to talk about. Who qualifies for surgical weight loss?
The guidelines say that patients qualify for surgical weight loss if they have a body mass index or BMI above 40, or that number could be as low as 35 if they have medical problems related to being overweight. It's very easy to calculate your BMI or body mass index. There are various calculators on the internet you can find. For most patients, that means they're at least about 100 or more pounds over their ideal body weight.
And how long until a candidate can have surgery?
From the time the patient sees me at the first visit until they have their operation can be anywhere between 3 to 6 months or even longer. Some patients need a lot of support in terms of restructuring their diet or even some mental health support as they approach a weight loss surgery, as it can be a very significant life change for people. So we want to make sure that by the time they get into the operating room, they're very ready for the changes that will happen afterwards.
I'm sure it varies, but how much will a patient lose?
It depends greatly depending on their height and their starting weight, of course. So for some patients, that may only be 60 or 70 pounds, but for patients who are much heavier, that may be 100 or 200 pounds. So it can vary quite widely depending on where they start from.
Now, one of the comments that Andrew made to us was that he felt really supported in your program. How do you offer patients the mental support? You touched on this just a bit, but to go along with the physical and surgical care you provide.
I'm so pleased to hear that he says that, because it is one of the missions of our program to make sure that we personally support every patient who comes through our door. We do not take a cookie cutter approach to weight loss surgery because every patient has a different story and different struggles, and we want to make sure that we can address that. We have a very well-rounded, comprehensive team, including a terrific nurse coordinator, a dietitian, and several mental health providers who help support our patients. We also have instituted support groups and classes that happen every other month for any patient who's either before or after surgery. And currently we're doing those online. So it's actually quite accessible for our patients to get access to those support groups. That's also an opportunity for them to speak to their peers and interact with people who have gone through the operations and maybe struggling with some of the same things that they are.
It sounds like it's a real collaboration. That's wonderful. Can you tell our viewers how qualified candidates can get started in the program at Penn State Health St. Joseph Medical Center?
Patients can call our surgery office and schedule their initial visit with me. We are a very personalized program, as I mentioned previously. So patients see me at the very first day in the program all the way up until their surgery. So they have a lot of interaction with me. And they also interact with our dietitian and our coordinator regularly. So to get started, all they need to do is give us a phone call to the office and we'll set up a visit.